Hey everybody. Um, I'm making a video today. I'm going to try to keep it within 10 minutes. That's what my phone is telling me I have to talk here. Um, but I've been wanting to do this video for a while because ever since I've been telling people that I'm going to Florida to get my neck fixed and get prolotherapy, people ask me what's that. So I've been wanting to explain mainly the difference in the kind of injections that you or someone you know may have received, and then prolotherapy, because there's a huge difference. And all the time, I find people who don't know this. And, just like I encountered someone this morning who was, asking what's going on with my neck. Am I getting better? And, oh, I need something. Like I've had everything. I've had injections. I've had, people have had injections and it didn't work, or they even got worse afterwards. And why is that? So I'm going to explain the difference in the injections that most people get because they're covered by their insurance, opposed to prolotherapy. And so the first thing you should question is, why are steroid injections, cortisone injections, botulinum toxin injection, I said that wrong, but why are those kind of injections covered by insurance, yet they don't really seem to be getting people better? And if they do bring pain relief or relief in symptoms, it's usually just temporary and it's not lasting, and actually your condition is getting worse. Well, why? I could make a whole video getting into, why those are covered by insurance, but prolotherapy is not. Because, think about it. If your condition's actually getting worse, you have to keep getting that kind of treatment and you have to keep relying on medication. That should tell you right there. It's not designed to get the person better. It's designed to keep the person coming back. Okay, so anyway, so that's the main difference between mainly cortisone steroid injections versus prolotherapy. Those injections, while they may provide temporary relief of pain, they're steroids and they're degenerative to your ligaments and your muscles and your tendons, whereas prolotherapy falls under regenerative medicine and pain relief. So prolotherapy rebuilds the structures that are worsening if you're getting steroid injections. And so that's the difference. And prolotherapy, by definition, is an injection technique that involves injecting a mild irritant solution, typically hypertonic dextrose, into the site of injured ligament or tendon to stimulate the fibroblastic proliferation of cells to that area that aid in the production of collagen, therefore rebuilding, strengthening, and repairing the injured ligament. And Dr. Hauser, if you're watching this, I better get A+ for that definition. And so it's regenerative. So it makes sense, when you have an injury, it comes down to do you want to just mask the symptoms or do you want to fix the problem? And, it's really crazy that so many doctors are not interested in fixing the problem. Therefore, people aren't getting better. Therefore, you're getting, more and more medication. I am someone who opted out of taking medication because my symptoms were so severe that logically it didn't make sense to me. Just take this prednisone, just take this Flexeril. I couldn't drive my car. My mom was drying my hair for 4 whole months. I could barely lift my arms, but Flexeril and prednisone is gonna fix that I can't lift my hands. I can't put my hair in a bun without getting nauseated and tremors, and Flexeril is gonna fix that. You know what I'm saying? So I'm glad that I was smart enough to not just take medications that mask symptoms. And I actually tried to get to the root of what was going on with me. And, so maybe if your symptoms aren't as severe, you might try medication and it's probably going to help for a little while, but it's probably going to get to a point where it's not going to help. And so, like, that's the thing. If I would have taken those medications, it would have maybe made me feel better, like, temporarily, but I would have never known to go to an upper cervical chiropractor. I would have never known that I had, like, the bad C1 and C2 misalignment and malrotation and instability. It would have just, like, prolonged me finding out what was really wrong with me and pursuing the right treatment. And I'm hoping that, like, it's not too late, that I didn't wait too long already because of doctors just passing me off, the gaslighting, the misdiagnosing. And, so I'm very upset that, my life's pretty much ruined. Like, hopefully I have hope now and I'm doing much better than I was then. But, like, still, it's still ruined, like, a year of my life, more than a year of my life, because of doctors just, following their thinking inside the box protocol of, what's supposedly rare and not rare. And, just, like, telling you what they're famous for is telling everyone they have anxiety and, not recognizing that, like, if a patient presents with symptoms of anxiety, that there could actually be a structural cause. Like, why did this patient only have an occasional panic attack, like, before this, and was a happy person, loved life, now all of a sudden can't function, can barely take care of themselves, and it's supposed to be because of anxiety, So I'm glad I was smart enough to know, that just taking medication wasn't going to fix my problem. And so I just want to make people aware of that, that there's options out there that can actually fix your problem rather than making it worse. And so, that's the thing. Prolotherapy is expensive, but, it's worth it, like, to actually get fixed, because, like, how many doctors, like, are you going to have to go to? Like, we've paid so much money. We paid Cleveland Clinic so much money. We paid UPMC, like, because everywhere, like, to go to a reputable doctor, that's, for me, it was out of my network, so you're paying, like, all this money to go to these supposedly reputable doctors just to be, diagnosed with, functional neurologic disorder, chronic fatigue. You think I have chronic fatigue? I've been terribly fatigued since these things I did to my neck, which has been more than a year ago now. You know what I'm saying? Like, so you either get these, by the book diagnoses thrown at you, or you get told to take medication, or you get told to go to a psychiatrist. I have not gone to a I am proud, so proud, that I have not gone to a psychiatrist this whole time. And guess what? My anxiety is better than is not only better than before, it's not only, like, better since my neck injury. My anxiety is better than it's been almost my whole life. And I have not seen a psychiatrist, So, like, I'm, like, living proof that there is definitely a structural issue sometimes. I'm not saying that's the case with everybody, because like, I've always had a little bit of anxiety, like, my whole life. So like, I don't, I think my atlas got misaligned May of 2022. So before that, let's say a year before then, if I would have gone to an upper cervical chiropractor, like, and would my atlas even have been off then? Like, maybe not. If it was off just a little bit, would it have helped my anxiety back then? Maybe not, because, like, my anxiety wasn't that bad back then. Like I said, I just had an occasional panic attack, and I had social anxiety, like, where if I'm around certain people that I feel like, that I know are judgy type people that are judging me, then I get, like, I get sweaty. I get a little bit, like on guard, like, your heartbeat might be higher or whatever, but that goes away, like, as soon as you're not around those people anymore, you're like, I can breathe again, or whatever, And so, I had, like, what I would consider normal type anxiety. And so I knew there was a total difference whenever I couldn't function anymore because of what doctors was telling me was anxiety. And I'm glad I'm smart enough to know that, like, no, there's something wrong here. And we just had to find it. And so I am running out of time already. But yeah, so basically, if anyone has any kind of like pain or issue, or if you have like anxiety or, like something that you just know isn't right, you have migraines, you have, like it's a wide array of neurological stuff can be caused from upper cervical instability. But yeah, just know that like probably what you're being told to treat those things like is very possibly degenerative and not regenerative medicine, and there's a huge difference, and that you actually can get better, and it's worth the money to actually get better rather than your condition getting worse.